Please, camera, find us. We are here at the Games for Health Europe conference, and who did the camera just find? Who are you and what do you do?
The camera just found Anna Sword. I'm a nurse and a gamer, and my mission is to make health fun.
And how do you do that? How do you make health fun?
How do I make health fun? Well, I based it on, I actually started my company Play Benefit in order to pursue what was going to happen with prevention and education for health, because we nurses do a lot of education and prevention for health. And we are doing it a lot like we were doing it 50 years ago, which is sitting the person down, talking to them, giving them information, and then giving them a pamphlet. And this is not very, it's not working. We need to have technologies take over and help us do that step further with the patients. So what I'm doing is I specialized on gamification and how to make things more engaging. So I thought if people get addicted to health, then they'll follow the pursuit in health. And right now we have two branches at Play Benefit. One of them is consultancy, so we help a lot this type of applications that, for example, are like for medication, to take the medication. Sometimes people start using it and then forget it and stop using it eventually. It's not that it's not useful, it's just not engaging, not understanding the patient. So we have a lot of this kind of request, or we have, for example, we're working with a hospital that wants to make the patient experience better. They want it to have him more empowered and more informed when he leaves the hospital. So we're working on that as well, and involving like the whole medical team, the whole nurse team, and, everyone that's going to be talking to these patients and the family as well. That's a very crucial point for us. And on the other side, we are developing our own app. We've said, so we've helped all these apps get better. How about we do it for ourselves as well? So we're starting to, actually the app will come out this January. It's called Be Energy, and it's about how to have great levels of energy throughout the day without like the spikes that we usually have, and then like get down at night and be able to have a good night rest until the next day.
And how do you do that with gamification, with game elements?
Okay, so the way we work is we work a lot with the user, understanding the problems that he has. Then what we do is we use a methodology where we transform the problems in actors and behaviors, and then once we spot the behavior that needs correction, we create a new behavior that we want to substitute it with, or we see how we can change this behavior in order to make it positive, and then we create game elements based on that. So the game elements would be something could be like rewards, something would be like the feedback loops are super important, and we tend to forget about them a lot. And in real life is a badly designed joke. I asked my students the other day, so how many times you get feedback on a day, and like 90% of them get less than 5 times a day feedback. So that's very bad design game. And so we do feedback loops. We look for ways to reward the person in knowing what they are growing into, what they are learning, how they are moving forward in their steps in life. That helps a lot, because most of the time when you follow a road, you think you're following just a series of steps. You don't realize what is actually in for me. So we look at what is in for you and make you realize what is in for you all the time, and what are you progressing, and how are you progressing. And that is we like that a lot. We like to be very productive in life. So if you make a system that makes you feel like you're being very productive every time you use it, you'll want to use it more. So that's what we do.
Yeah, and you say I am a nurse, or I used to work as a nurse. So how do you see a nurse working with things you do, or the game elements in her work in the future? So
as a nurse?
Yeah.
Okay, so first, that's a very good question. I consider myself very much a nurse. I think once you've been a nurse, you're always a nurse.
Yeah?
At least I get, like, no matter who's around me that knows me that I'm a nurse, they will go like, look, what is this? You know? Or my sister sends me a picture of her daughter and be like, what is this? So you're always a nurse. And I also think like a nurse. I think that's a very good advantage when I'm designing. I found that out. I've never gotten anything about, you never think think you're creative until you're put to test, right? I mean, I've never got any awards at school or anything like that. Never thought I was creative. Nursing is not a highly creative career, right? But turns out we're great designers because we not only see the disease, we see the patient. We not necessarily focus on the disease as much as other healthcare professionals. We focus on how is this person doing? Is it doing better today? Has he puked? And we also see the family very close. It's very related. How is this person feeling? It's very related to the environment. It's very related to the family. It's very related to how I am taking care of them, how I empathize with them. So we see all these 360 that surrounds the disease, if you want, the person. So I think that makes us really good designers. And how do I see these impacting in the way we do things? I think nursing and healthcare in general is very slow. It's very fast on taking like new lasers and like evolving technologically speaking. However, on taking it on us to evolve our way of doing things, we're very. It's difficult, but on the other hand, I see that, for example, an engineer talking to a healthcare professional trying to sell them what they're doing is harder than me talking to a healthcare professional saying, look, this is going to help you on this, because they can relate to me and I can relate to them and their experience. So, what was the question again?
We started with how is it going to affect the work of a nurse in the future. That was what we were talking about. And what now you were saying, I do understand that, of course, because you know the other side of the story. So you're not you're an insider and not an outsider talking about all the things and how gamification can change the world. Because maybe they listen easier or earlier to you than to an outsider. Is that what you feel as well? Do you have that impression? Are you taken more seriously than another game designer?
I think it's not only a matter of being taken seriously. I think it's a matter of when you talked about their problems, they can relate to it. So I know the problems that they face because I faced them myself. So it's not about me telling you how to solve something that I assume that it's your problem. It's I've been there. When I've been there in front of that, I've chosen this, which was what I had available. Now you're going to have this available as well. So maybe you could try to go this way and have this and disadvantages. So I don't know. It also when they have questions, they feel like I understand them better and I'm able to solve actually the question that they're asking. So that's
Well, on stage here, what is the one message you want to get across to the audience today?
To the audience tomorrow, because I'm speaking tomorrow.
Okay, then tomorrow at the event,
Okay, so the message that I really want to get through is that this is not on my hands to do this change. It's in everyone's hands. So what does this mean? It means that the more people that talk about this and make it a reality, the sooner it's going to be a reality. It's not this crazy nurse talking about this. I was in Games for Health 4 years ago, and I was this crazy nurse talking about how to use video games that were played by 12 million players into health. So I was this crazy nurse that geeked out and stuff. And today I'm this nurse that actually has a company and has accomplished things and it's starting to move the world, and I would like to not be the exception, to be some sort of other way, other career that you can take when you are in a healthcare profession. That there's a digital health profession that is available for you if you study, whether you're doctor, nutritionist, physiotherapist, whatever. It should be one of the possible endings of the career. So what I'm saying is, let's try to make it in all of us to actually make this forward, whether it is by when you teach at school. There's a lot of professors here as well. When you teach at school, make sure that you mention this, that you mention it, like you could be one of them as well. It's not like these few separate people that do this.
So you said yesterday, I talked to my students. So you're teaching as well.
I teach at the university.
And over there, is it for your students? Is it a logical thing? Are there still barriers to break when you talk about using game elements in the health sector, or is it already a normal thing for your students?
It's incredible how second year students can be already super protocolized and no critical thinking, just follow the protocol and then you're going to do it right, you know. It's I try to get them to have more critical thinking, and I try to get them through that. It's not about what I teach them now, it's about what they can do with the things that arrive. So I tell them it's not about me telling you this app works, because this app works now, which is 2 years before you graduate, 2 years after you, when you graduate, this app will not exist and the market won't be relevant. So it's not about what I teach you now. What I teach you is like, okay, be open. You need to understand this. You need to download it, try it, and then say, okay, this one will be functional. This one I will use for people that have social issues with diabetes, because it's an app that's very social and has a great help and stuff. And then for another one, that the problem that he has is to actually be motivated to log their logs. Has no problem socially whatsoever. He has a great people around him that help him with the diabetes. That's no problem, but he has problem logging in the data. Well, maybe you should use this other app that actually concentrates on this more. So you know who your patients are. Use technology to help you as a professional have better care of your patients.
So openness and critical thinking are so the more general things you want to teach.
Yes.
And that's because in a world that is changing so fast, that's what you should be. Adapt, try, learn.
Yes.
Things like that.
Exactly. And protocols are great. I mean, they are a very efficient way to work until proven wrong. If something is not working anymore, you should be able to have a creative way to solve the problem. I also teach creative ways to solve problems, because I think that's super necessary, especially if you're a nurse, which you're in the first fire row, to put it this way, and you see everything. You see the doctor, you see the patient, you see the family. So you need to be able to think that you can actually do something to make it better, to improve it, to create a solution that's creative and fixes the problem.
Yeah. You said a couple of years ago I was speaking here as the crazy nurse. Now I'm the crazy nurse with a company. So when you're here in 4 years' time, what will you be then?
What do you mean?
Well, from crazy nurse to crazy nurse with a company to what's the next step?
So the next step would be being the regular, being one of the people that started this movement that now everybody knows about, and it's like so old school. That would be my ideal. Not be special anymore. Exactly, that's my goal. Not be special anymore. Actually, be camouflated and be like the nurses took over the world with gamification. That would be my best. I would be so happy with that.